Welcome to the Giving Voice to Depression podcast. We're your co-hosts, Bridget
and Terry. Each week, we explore a different perspective on or experience of depression because it varies in form and severity, affecting us differently. Our guests share intimate details of their struggles, coping strategies, and recovery. We keep it real because the struggle is real. We keep it hopeful because there is hope, in spite of what depression tells you.
We're not experts or therapists. We're sisters and best friends who live with depression and know that talking about the illness reduces stigma and humanizes the experience, making it safer and easier to ask for needed support. You are far from alone.
Today's podcast is sponsored with a Garrett Kelly Memorial Grant from the Charles E. Kubly Foundation, in loving memory of Garrett and others who've struggled with depression. We are solely responsible for podcast content.
Hi, Terry.
Hello, Bridget. So an article published last week in Psychology Today titled, "When Doctors Are at Risk for Suicide," reports that roughly half of U.S. physicians surveyed believe they have met the criteria for mental illness in the past, but didn't seek treatment. The reason? Primarily stigma.
There's that word again.
I know.
Stigma, defined as a mark of disgrace associated with a particular circumstance, quality, or person. There's still so much work to be done, Terry.
Yeah, also known as discrimination, but yes.
Research published in the Journal of the American Medical Association found that stigma attached to mental illness is greater among medical trainees and physicians than in the general population.
In fact, studies show that 50% of doctors are less likely to work with a colleague who has a history of depression or anxiety disorder, with 4 in 10 admitting to thinking less of such a colleague.
Wow.
Yeah.
We found someone with a unique vantage point to discuss this reality from both sides. Dr. Weinstein, an acute care trauma surgeon who lives with depression and has been treated in a psychiatric hospital. A surgeon patient, as he calls himself.
So we first learned of today's guest in the New England Journal of Medicine. We're not going to pretend to be regular readers, but when a doctor writes a first-person essay called Out of the Straitjacket, it catches our attention. So we reached out. Will you start by just introducing yourself and telling me a bit about you, and particularly, is it Weinstein?
Yeah, so Michael, I guess you want me to formally kind of say something here.
Sure, go for it.
So it is Michael Weinstein in Philadelphia. Been in Philadelphia for a long time, and I'm a physician. I've been a surgeon for a long time. Actually, right now I'm kind of taking time away and working to figure out what's really next for me and what's going to be most meaningful and fulfilling and support my mental health as much as possible.
In Dr. Weinstein's essay, he wrote that from the outside, he appeared to have it all. A surgeon with leadership promise, earning more than he'd ever expected, an amazing wife, 2 great kids. But in reality, he says he was just enduring life. He wrote, quote, "I'd heard of burnout, but didn't really comprehend it. And though I had mental illness, I still saw it as a weakness, a personal fault. I remember early in my career hearing of a colleague who'd taken a leave of absence for a nervous breakdown. I joked about it, said he was weak. Now it's my turn." There are so many things I want to ask you. So if a doctor who's gone through medical school and had all the training can see mental illness when he experiences it as a personal failing, as a weakness, is this all, I hate to use a word like indictment, but of the education you got? I mean, shouldn't doctors be coming out understanding that this is a real illness and the symptoms of it and the triggers and the risk factors, and then a little bit of empathy maybe, please?
So there's a couple layers to this question.
Yes, there were. That's because I rambled.
No. I'm just as I'm just trying to piece together. You didn't you didn't ramble at all. One, there are some serious problems with medical education, with the practice of medicine, with our healthcare system. And one evidence of that is, that when people come to medical school and you look at rates of depression, they're pretty much on par with the general population. Within a couple years of medical school, especially when they get to their clinical years, when they start spending time in hospitals and with senior doctors, those rates start to increase. And then when they enter their training, their internship and residency, those rates increase further.
Weinstein concludes there is clearly something about that process that needs to be changed in major ways.
We had somewhat of a medical education revolution back, I think, maybe even almost 100 years ago now. We need a major revolution to change the way in which we're educating. And there's some positive changes, and there's definitely a focus on that now. But we need there's a lot more work to be done.
The second part of my question addressed the need for the medical community to have understanding and empathy regarding mental illness.
All of my colleagues probably would describe me as a compassionate and empathic physician. And I can extend that compassion and empathy to others quite well. And in fact, what a lot of folks are saying is that the people that are most empathic and most compassionate are probably at the highest risk of having their own episodes of burnout and depression. And many of us, I know I still do, right, finding that self-compassion and that self-empathy challenging, because it's in some ways, whether it's part of medical education or not, or whether it's part of anyone's upbringing, you learn to want to care for others and want to be of service to others without necessarily thinking about how you're being of best service to yourself. So, teaching that self-compassion, teaching self-awareness, to me, the practice of mindfulness really needs to be integrated from the very beginning of medical education, or for anyone really who's going to be providing care to others, whose work is of service to others, as most of us really are, but especially so in the healthcare system, because you're attending to other people's suffering on a routine basis.
So one of the lines in your article, you said colleagues were trying to help you, but you were unreceptive to their efforts. And then the very next line, you said, I was trying to get help in many ways, but nothing seemed to be working.
Yeah, I tried to rewrite that several times as carefully as possible as well. I think in some ways what I was trying to say between the lines perhaps is that I think people recognized that I was suffering and had no idea how to help. I think unfortunately because of a lot of different reasons, people don't necessarily know what to say, what to ask, how to listen, how to be supportive. And in many ways, I think many times our default is actually to be avoidant of these conversations, at least in my profession.
And there's that other internal part of the equation.
And then in many ways, I wasn't particularly receptive, even for, small gestures of help, because I thought I wasn't worthy. I thought I was not, it was my issue, it was my failure, it was my problem, and that I in many ways, one of my many faults is not wanting to ask for help, is to feeling like I should be able to take care of all of this on my own. In many ways, in my workplace, my self-criticism comes to how come I can't take care of all of this on my own? How come I can't, change the culture of such and such of, in my intensive care unit? How come I can't fix that on my own? And so in some ways it was both, right? So it was that people don't necessarily know how to simply ask how people are doing and want to stop and listen and just honor someone else's suffering. And there's a lot of different ways to potentially do that and be helpful to another person, simply asking what would be most helpful instead of maybe sometimes jumping to giving advice. But there was another part of me that just really didn't want help. So I was, in the next sentence, I was looking for help, right? So I was trying to see I was seeing different therapists, psychiatrists. I was reading different things to try and find, again, I can figure this out. I can find my own solutions, but nothing I could find was helping.
Mm-hmm. If you were an accountant or an engineer or, whatever, saying, in my profession, people tend to be avoidant of these conversations. The fact that you're a doctor, and when you're talking about the medical profession, kind of makes the hair on the back of my neck stand up.
I know.
Of all of the professions, I would want the medical profession to be least avoidant. Right.
And I don't know, right? I don't really know other professions. I certainly imagine, much especially in our Western society, many people are avoiding about these conversations to begin with.
Absolutely.
And that's what we are here working to change, right? There may at times be folks who are better equipped in medicine to do this and to help others. And, I know in some ways I was one of those, right? So I was really good at helping folks who were going through difficult times. But at the same time, I think especially in my world of surgery, but a lot of for physicians especially, I think there's this notion that we need to be know-it-all, be strong and not susceptible to these types of things, and that even asking another physician about that or checking in on another physician how they're doing is like asking if they're weak, So it's kind of, you're right. You would hope that that physicians could treat each other as well as they treat their patients. Not that we all always treat our patients, as best as we can either, but that's not the environment that I found. I always say that.
So this episode focused on Dr. Weinstein as a surgeon. Next week, Michael tells the personal story of his experience with depression, including his doctor in control to patient losing control in a psychiatric hospital.
I keep thinking of that Bible quote, Terry, of physician, heal thyself, or that metaphor of, put your oxygen mask on first. We all need to take personal responsibility so that we can help others. It's just this cycle that goes around and around.
And I love that he's not only taking care of himself, but genuinely trying to start a discussion among and about the medical community, because when you publish that article in the New England Journal of Medicine, that's what you're going to do. So that's impressive and brave, and I really enjoyed learning more about Dr. Weinstein, and next week's episode, you'll learn an awful lot more.
I look forward to it.
Yeah, thank you. And thank you, Dr. Weinstein, for joining us. We agree with you that sometimes the medical education, even from the outside, looks more like a frat hazing ritual than a reasoned approach and a caring way to train the people who we count on to care for us. So thank you for starting this discussion.
We truly hope that our podcast brings a little more understanding, helps you better articulate your experience of depression, or better understand how to support someone else's.
We invite you to join us for daily posts on the Giving Voice to Depression Facebook page and on Twitter and Instagram at Voice Depression. It is a comfort to be among fellow travelers on depression's dark road.
And remember, if you're struggling, speak up. If someone else is, listen up.